Hi, welcome to Pathology Riddles. Today we are dealing with this topic called Common Mistakes MBBS Students Make in Exams. As the exam seasons are going on, we thought this topic will be beneficial for you so that you don't commit the same mistakes and lose out on marks. So let's discuss which are these mistakes. First mistake is difference between granuloma and granulation tissue. Since they start with almost the same letters, there are many times when MBBS students get confused. So what do you mean by granulation tissue? Granulation tissue is actually a part of a repair and healing process. It consists of fibroblast proliferation, thin-walled capillaries in loose matrix, and inflammatory cells, particularly macrophages. Let's see what granuloma is. Granuloma is a chronic inflammation. It consists of epithelioid cells, lymphocytes, and sometimes necrosis. The most common example that we take is tuberculosis. So remember, next time granulation tissue and granuloma is asked, look at the word carefully and then answer in the exam. The next question that students make mistakes is in adenomyosis and endometriosis. So what is adenomyosis? If the endometrium grows in the myometrium, it is called as adenomyosis. If we find growth of endometrial glands and stroma outside the uterus, then it is called as endometriosis. That could be in the ovary, that could be anywhere in the pelvic peritoneum or the abdominal peritoneum. So remember, what is adenomyosis, what is endometriosis. The third mistake is people confuse granuloma to be a benign tumor. Why do they get confused? Because it ends with suffix oma, and we usually teach that all the benign tumors have the ending as oma, O-M-A. But remember that granuloma is chronic inflammation and it is not a benign tumor. Similarly, people also think that lymphoma is a benign tumor, but lymphoma is actually a malignant tumor. So just because it ends with OMA, do not think that it is a benign tumor. Another example is atheroma. Now, atheroma is a disease of blood vessels, especially related to the atherosclerosis, that is the lipid collection in the under the intima of the blood vessel. So atheroma, lymphoma and granuloma, these are not benign tumors. Remember to read about what these things are. Sometimes when this malignancy is asked in the exam called Mbbs tumor, then you get confused whether it's neuroblastoma or nephroblastoma. Remember that nephroblastoma has the word nephro in it. So nephron is seen in the kidney and nephroblastoma is Mbbs tumor. The next common mistake that students make is not understanding the terminologies. That is, if etiology is asked, don't write about mechanism. Etiology means cause, causative agents. It could be bacterial, it could be viral, it could be immunological, it could be genetic, and all those are the etiology of the disease. By pathogenesis, we mean how does that causative organism cause the disease? You have to write the mechanism, what all happens in the body and how exactly this disease is caused by the agent. So that is pathogenesis, the mechanism. And when we ask what is pathology of the disease, then you will have to write gross and microscopy. That means what are the changes we see in the organs, both by the naked eye as well as under the microscope. You will always have to divide it as gross and microscopy. The last part is the exam paper presentation. Most of you know how to present your paper, but for those who do not, remember that you need to write the question numbers correctly. The Roman number as well as the sub number under it has to be written so that we identify which answer you're attempting. Because if this question number is not written or it is the wrong question number, then we will think that you have written the wrong answer for the wrong question. Then you will not get the marks that you deserve. Second, present legibly. Your handwriting should be at least able to be read because we find it very difficult to understand what you have written if it is very written very haphazardly. Third is structure your answers. Instead of writing essays, if you write it in bullet points, you will score more marks. For example, if you are writing differences question, don't write paragraph on top and paragraph below. If you write that particular difference against each other, make a column, make a line in the center and write next to each other in two columns. Then you will score more marks. So remember, write in bullet points, write as flowcharts, draw diagrams wherever necessary, and structure it in a way that you give that impression that you know a lot. So sometimes it is really difficult to remember a lot of things the day before the exam, but if you structure it well, you will get more marks. So these are the points to remember, and I hope you don't make the same mistakes which people have made in the past. And all the best for your exams. This is Dr. Susan signing out until we meet in the next video.